Welcome, I am Veronica Schiariti. I'm a developmental pediatrician affiliated at the University of Victoria in British Columbia, Canada. I will briefly describe our paper published in the September 2018 issue of the Developmental Medicine and Child Neurology. The title of the paper is International Classification of Functioning, Disability and Health Core Sets for Cerebral Palsy, Autism Spectrum Disorder, and Attention Deficit Hyperactivity Disorder. I'm presenting on behalf of my colleagues at the Karolinska Institute in Sweden. What is known? To standardize the description of functional abilities, health, and disabilities of individuals in the context of a health condition, the WHO created the ICF as a reference family classification. The ICF offers a framework for understanding functioning and disability from a biopsychosocial perspective. The model views disability not as a person's attribute, but as a complex collection of conditions and relationships that are created by the social environment. Functioning, as you see here, is a key dimension in the ICF, defined as what a person with a health condition can or is able to do every day, including physical abilities and social participation. In this model, functioning is viewed in relation to the health condition, here CP, autism, and ADHD, in relation to the personal and environmental factors. The model includes 4 components: body functions and body structures, activities and participation, personal factors, and environmental factors. What is the challenge? The pediatric ICF contains almost 1,700 categories or alphanumeric codes, challenging, if not impossible, to apply in everyday practice. To apply the ICF in research and clinical practice, ICF-based tools must be developed, and we're presenting and describing the content of the ICF core sets for CP, autism, and ADHD in this paper. An ICF core set is a list of ICF categories that serves as international standard for describing functioning and disability. ICF core sets summarize what should be measured and reported for a given population. The development of the core sets incorporated all relevant perspectives, and you can check the references on the paper, but we want to highlight that it was a multi-step methodology endorsed by the WHO, and all the perspectives, including the clients and the families, were included in the process. The ICF and the ICF core sets have multiple applications, and these are some of them. They can be used as a conceptual framework, as a universal language, as a classification tool, or as a method to compare functional data. What this paper adds: the specificity of the content of the ICF core set for childhood-onset disabilities have been challenged in the past. Therefore, in this paper, we took the task to compare the content of each one of the core sets to identify if a generic or a condition specific core set is needed. So we have shown that each ICF core set for CP, autism, and ADHD capture unique functional information, as well as the unique role of environmental factors influencing functioning and disability in this population. An example is provided in figure 2 in the paper, and you can check more detailed information about the content of each one of the core sets in different figures and supplemental material in the paper. What this paper adds to clinical practice and research: the global application of these core sets will enhance our understanding of the functioning abilities of CP, autism, and ADHD, as well as complement diagnostic information with much needed meaningful functional data. It is important to clarify that standardization does not prevent individualization of data collection or care. Standardization of functional information by applying or adopting the ICF core sets ensures that professionals and families incorporate a biopsychosocial approach, systematically addressing social domains and the crucial role of environmental factors facilitating everyday functioning. There are some knowledge translation initiatives that you can check, and we have referenced this in the paper. And you can check different case studies and download information and practice and learn in an interactive way. It's an open access website. Enjoy your reading.